We found that there was a 30% decrease in admissions of heart failure as compared to the previous years. So people stayed home, and also people who have chest pain or having a heart attack tend to stay home more, and then as a consequence of heart attack they develop heart failure, and then they present to their primary care doctor for shortness of breath, which is the main symptom of heart failure.
Why are they staying away? Is it the fear of going into the patient room and contracting COVID? Is that the...
Yeah, it's fear of coming to the hospital and getting COVID. They need to go back to their cardiologist and establish care again, and then after evaluation by the cardiologist they will figure out what's the right plan for them. Because pre-existing heart failure is a risk factor for mortality and morbidity in COVID infections.
Okay.
So if you have heart failure, you have a higher risk of developing complications. And you can develop a new heart failure from COVID infections as well.
Can you kind of talk about the prevalence of heart failure in this area?
Very widespread. It's very high incidence and prevalence of heart failure. I think it's mostly because of high blood pressure which is left untreated, and then also the obesity, which we have a pandemic going on side by side with the COVID, and complications from obesity like obstructive sleep apnea, or then people have heart attacks and don't show up to the clinic. And we see a lot of those patients that are having active chest pain for a week, for 10 days, stay home, and don't show up to the hospital or their doctor.
Okay.
Everybody, almost all of them have a high blood pressure which has been untreated for a long period of time.
So you have the patients that had this and went untreated, and then you've got patients that contracted COVID and are having heart problems.
Yes. I think the most important thing is prevention. People can prevent this from happening if they treat themselves rightly, go to their doctor on time, start establishing care with their primary care physician, and follow up on a routine basis, do the baseline preventive screening for diseases, and that will prevent a lot of diseases down the road.
Okay, so for like an annual checkup.
Like an annual checkup, they check your blood pressure, they examine you if they find something, and there are some preventive measures like you are 45, you need a colonoscopy, or you need an EKG, you check your cholesterol, all those tests, they are done routinely. You don't have to get sick to get those tests.
Okay.
And they are usually covered by the insurance for primary prevention.